I'm John Schall. I'm the Chief Executive Officer of Caregiver Action Network, which is the National Family Caregivers Association and the nation's leading nonprofit association advocating for the interests of the tens of millions of family caregivers across the country. I think this is a wonderful opportunity to talk about the policy landscape from the aspect of family caregiving. The fact is, right now, there's a lot of activity when it comes to family caregiving and a lot of policy and policy proposals that can affect family caregivers across the country, but actually getting any particular policies passed or really to stick with critical mass is somewhat difficult. But let's talk through a few areas about family caregiving and the policy landscape and really the complicated landscape of what's going on out there. The fact is, right now, there are tens and millions of Americans who are family caregivers. And the interesting thing about family caregiving is that it's kind of like life itself. So it really touches every aspect of life in healthcare. One moment you might be struggling with your own depression. At another moment, it's how to manage the medications of your loved one. Otherwise, it's how to make sure you can handle the transportation to and from doctor's appointments. The point is that family caregiving just really encompasses such a broad spectrum of issues and challenges that, not surprisingly, policy proposals that could address that, help it or hinder it, can be fairly widespread along the spectrum as well. But I really want to talk about it from four standpoints. First of all, supporting family caregivers themselves. Right now, slowly but surely, policymakers have caught up with the idea that family caregiving really is a critical part of healthcare in the United States. What we really need to get to is where family caregivers are included as a vital part of the healthcare team, really from day one. Now, why do I say that? Because interestingly enough, if we look at numbers, it's, for instance, with medications, most of the time, up to 70% of the time, our data shows, it's not the patient themselves who manages their own medications. It's actually the family caregiver who manages their medications for them. The more serious the condition of the loved one, the more likely it is the family caregiver is managing the medications. So if we are concerned about, adherence to the medication regimen, it's important that the doctors and the patients not only talk, but that the family caregiver be part of that from the very, very beginning. Really, what we've seen happen in American healthcare in the last few years is more and more healthcare has been pushed to the home. We're in the hospital for much shorter stays than we ever were before. There are things that are done outpatient, which were not done outpatient in a previous generation. That's good in terms of costs and really health outcomes, but it puts a whole different burden on family caregivers who now all of a sudden have to do a whole series of fairly sophisticated tasks in the home that we normally associate with doctors and nurses. And that's why I think for supporting family caregivers, it's not only making sure they're a vital part of the healthcare team from the very beginning, but that we begin as policy to take training for family caregivers very, very seriously. None of us is born knowing how to do this. More than half of these 10 million Americans are actually performing these fairly sophisticated tasks, IVs, wound therapy, you name it, that you associate with doctors and nurses. So it's very important that policymakers catch up with, let's now finally do some genuine training for family caregivers. Another aspect, the second aspect I want to talk about this from is from the financial side of things. Family caregiving is pretty expensive. It takes a huge bite out of anyone's pocketbook. There are just so many things you do as a family caregiver that are not covered by insurance or not covered by Medicare that you really pay for out of pocket. My mother happens to be incontinent with her Alzheimer's, depend or something. All of that's coming out of my pocket. It's not being paid for by Medicare or by insurance. So when it comes to financial issues, we really need some financial relief for family caregivers. And policy-wise, this really comes into two big buckets. One for low-income individuals, and that really centers on the Medicaid program. There are very, very few places in the United States structure where you can actually get paid for being a family caregiver. There are some waivers under Medicaid where in certain states you can actually be paid. These are very, very few and far between. The only place that's on any serious scale is the state of California. Certainly, very important for policy to expand that ability under Medicaid for family caregivers to be paid for the effort that they have to do. With low-income people, similarly, home and community-based services under the Medicaid program need more funding. Right now, home and community-based services is about 50% of the total Medicaid budget. But really what you have is a very long list, waiting list of people trying to get these services that can help them at home so they can stay at home longer. There have been proposals in President Biden's budget and other programs to actually dramatically increase the funding for home and community-based services, but it hasn't happened yet. That's the low income side for financial. The middle income side is almost just as important because this is a financial drain for anybody. It's about $7,000 to $10,000 a year out of pocket. If you think of median family income in the United States being about $10,000 a year, yeah, up to $10,000 is a pretty big bite. So policy-wise, there have been proposals for tax credits to handle some of that, up to $10,000 worth of expenses that come with family caregiving. That can be done at both the federal level and the state level. A lot of states have decided on their own, perhaps, to move with tax credits. We've been fighting for years to do it at federal level. But also some other ways of getting at it that are just worth knowing from a journalist standpoint, that there are other policy mechanisms for giving financial relief to a middle income person. For instance, a lot of family caregivers end up leaving their job because they can't juggle both their job and the caregiving responsibilities. Well, in doing that, obviously they lose their salary, but they also lose that time when they're not on a job. That time doesn't help them for their own Social Security benefits. So another policy proposal is to grant Social Security credit for those years you're not working because you're a family caregiver, but to give you credit as if you were, so that your ultimate Social Security benefits when you retire are not reduced. So there are lots of ways at this very important financial part of the issue. The third area I want to talk about very briefly is the workplace and the workforce. Most family caregivers are actually working full-time. More than 60% of family caregivers are on the job, juggling their work and their caregiving responsibilities at home. Because of that, the best place to support family caregivers is in the workforce, in the workplace. And policy needs to catch up with that. Certainly, the most basic way you can think of that is more flexibility in terms of leave for family caregivers. Caregiving happens, it just happens. You're on your way to work in the morning and you get a call that mom fell and she's at the hospital. Well, I might be scheduled for my shift in 15 minutes, but I got to get to the hospital to see how mom is because she just fell. So that's sort of flexibility, but it doesn't end there. And if it ends there, then we've really missed the policy opportunity. What we want are supports in place even before you get to that point where caregiving happens and you need the flexibility with hours. Supports in place for how to keep a family caregiver healthy and productive in their own right. Because the whole idea is being a family caregiver takes such a tremendous toll on your own health that it really puts you in jeopardy. The sheer stress of being a family caregiver. So supports that can be put in place by the employer, really for not very much cost, can really go a long ways to helping the family caregiver situation. Workforce itself also is important. Uh, we need paid in-home care workers in the United States. At some point, many of us as family caregivers realize that we just can't do it all on our own, and we need to hire someone to come in. Unfortunately, right now, there is a crunch in the availability of those in-home paid workers. They don't make a lot of money, so they're not necessarily people clamoring to do these jobs. But we've got to fix that because we have a huge need for these people. And so in terms of licensing them, training them, credentialing them, making sure they're qualified, making sure they're getting paid, so they really can be available to family caregivers as we need them. So there are a number of policy issues that come into play there in terms of minimum wage, immigration, et cetera, licensing at the state level that are hugely important to make sure that the workforce is there. So when we as family caregivers need to bring someone in the home and to hire them, that they're available. Lastly, I just want to say a couple of words about government approach itself when it comes to family caregiving. The fact is, none of us should wait around with bated breath for the government, especially the federal government, to take the lead on any of this stuff. They've been very, very, very slow. There's been a lot more attention, certainly this year and last year, that there have been in previous years. But just to give you an example of how slow it takes, HHS came out just recently with its Family Caregiver Advisory Council report. Hugely important. First time the federal government's done it. It's a long, detailed report. The report was first called for in 2016. The law to create it was 2018. Here we are in 2022, and finally, there's this report, which isn't so much a strategy, isn't so much a plan, as is a very comprehensive laundry list of things that are done at the federal level for family caregivers, to the tune of 350 activities. It's not really so much a roadmap, so it's a huge step forward in recognition from the federal government, but it's just an indication that to wait for federal government to take the lead on some of this stuff is perhaps nothing more than wishful thinking. There are a lot of other areas of government policy that affect directly family caregiving as well. Ultimately, in the end, as family caregivers, what is most important to us is the health and well-being of our loved ones. And so I just want to give an example of newly available drugs and therapies, right? In the end, as family caregivers, what we will want is new drugs, new therapies, new ways of addressing the conditions and diseases of our loved ones. So when FDA, for instance, is going to approve a new Alzheimer's drug or a drug for ALS or some other disease, that's hugely critical to family caregivers because we want new therapies for our loved ones. And that goes for the same thing on the how you pay for that side. FDA approving new drugs, which obviously we need. And then when it comes to the Medicare population, to make sure that CMS agrees to pay for them if they've been approved by FDA. So you can get a lot of very mixed signals from the federal government. And, in a lot of ways, intentionally or not, the federal government can really get in the way of what family caregivers are trying to do in the best interests of their loved ones. All of this is to say it's a very complicated and dense policy landscape when it comes to family caregiving. There's a lot going on out there from a lot of very different angles, faces of the issue. But that's why it's important at least to go in with the understanding of this broad array of the types of policy implications that there are so that one can start to sort them out. But there's no question, as we sit here right now, this is one of the biggest needs, the biggest healthcare issues for us that we're immediately facing, because the need for caring for our loved ones, our elderly loved ones especially, is growing exponentially. And there are just fewer of us of caregiving age to be able to do that. So we're going to need to rely on volunteers that we haven't done before. We're going to have to train family caregivers to do some pretty sophisticated stuff they never did before. And the healthcare system is going to have to make sure that family caregivers are really involved from day one if we're going to get the best health outcomes, because care is being done at the home, and make sure that our, for instance, our loved ones don't get readmitted to the hospital, because we're the ones who'll be caring for them after they've been sent home from the hospital. It's a lot going on, a lot to keep your eye on, a complex situation, but really a very, very exciting time for family caregiving in a policy landscape.